So, Bismillah, let's learn about oral care products as per your chapter in dosage form sciences. So, there is a quote of Dr. Jeff Cott, was a dentist. So, what he says, it is time for us not to think of our mouths as somehow disconnected from the rest of our bodies. The same blood flows through them, the same nerves go through them. To have a healthy body, you need a healthy mouth. So means you must have to take care of your mouth. ठीक. So now you can see the various oral hygiene products. I can just to remind you, you are aware of these products. Daily you have to use paste, rinse, mouthwashes, whatever it is. So you can see just various oral preparations. Introduction. Now we are going to how to clean the teeth, how to make the hygiene. So you can see with this picture how to maintain the hygiene, oral hygiene, how to make service your mouth, your teeth, whatever it is. So from introduction we have to start this. So what's oral hygiene? So oral hygiene includes all the process for keeping mouth clean and healthy. Good oral hygiene is necessary for prevention of dental caries, periodontal diseases, bad breath, and other dental problems. So means you have to make clean your mouth, that is oral hygiene. Then what's the importance of good oral hygiene? Prevention is always better than cure. Good oral hygiene habits will keep away most of the dental problems, saving you from toothaches and costly dental treatment. So if you may not take care of your mouth, there can be problems, there can be disease, and there can be, then you go to a dentist and you have to pay for that one. Awareness regarding the importance of oral hygiene has significantly increased in the developed countries, but contrary to that, the modern dietary lifestyle habits are posing a greater risk for oral health. Good oral health is important to overall well-being. So that's why you must be aware that to keeping oral hygiene. By maintaining good oral hygiene, you can prevent with following type of diseases or problems. There can be dental caries, there can be gingivitis, there can be periodontitis, and most is there can be halitosis. So you know about dental caries, you know gingivitis, you can learn about. So what is a periodontitis? It is also known as gum disease. It is a serious gum infection that damages the soft tissues and without treatment can destroy the bone that supports the teeth. Periodontitis can cause teeth to loosen or lead to tooth loss. Periodontitis is common but largely preventable. You can see in this the healthy the gingivitis is there, inflammation of that gums, then there is a periodontitis. Then there is halitosis. Halitosis, the microscopic uneven surface of the tongue can trap bacteria that produce odors, contributing to bad breath. Bad breath, also called halitosis. You can see there is a halitosis. What is causes of halitosis? So by mostly older age, if you do not clean your teeth, your mouth, so there are chances of halitosis. Now, before going to the hygiene, you must know about the anatomy of tooth. So there is first, if you see a tooth, its anatomy is that one crown of part of the tooth above the gum line is known as crown. So it's enamel, it's dentine. It has composition of gum and dentine. Then second root of the tooth sits in the bone below the gum lines. You can see the root of it is pulp chamber and root canal, bone, periodontal ligament. So mostly sometimes there's a problem in your teeth. So uh, you go to the dentist. He used to say, I'm going to do RCT. They are going to do it's a root canal treatment. It's a root canal. So when they discontinue the attachment of the roots, so there will be no pain. So yeah, they used to do the RCT root canal treatment. Then crown of the tooth, its enamel is the first layer of the tooth, considered to be the strongest tissue in our body. When we chew, our, our bite exerts about 130 pounds of pressure on our tooth, our teeth, protective shield to the rest of the tooth structure. So dentine, very strong structure, although it is a much weaker than enamel. Then you go for root of the tooth, a pulp chamber and root canal. It's a hollow area, life source of the tooth. Pulp, it is a nerve, artery, and a vein. It provides nourishment for the tooth during growth and development. When you go for the bone, is around the roots of the tooth, acts as an anchor. See periodontal ligament, layer between the bony socket and the root of the tooth, acts as a cushion to protect the tooth and bone against the shock of chewing and biting. Third is the dental caries. Now dental caries, their tooth decay. You can see in the picture how this caries affected this tooth. Is an infectious disease which damages the structure of the teeth. The disease can lead to pain, tooth loss, infection, and in severe cases, death also caused due to dental caries. Then dental caries caused by certain type of acid producing bacteria. So it is caused by certain types of acid producing bacteria. What they do? They damage in the presence of fermentable carbohydrates such as sucrose, fructose, and glucose, resulting in acidic level in the mouth, affect tooth's special mineral contents cause it to be sensitive to low pH. If pH drops below 5.5, demineralization proceeds faster than remineralization. There is a net loss of mineral structure on the tooth's surface. So maintaining oral hygiene. Good oral hygiene results in a mouth that looks and smells healthy. This means teeth are clean and free of debris. Gums are pink and do not hurt or bleed when brushed or flossed. Bad breath is not a constant problem. So what you have to do? Daily preventive care, including proper brushing and flossing, will help to stop problems before they develop. Regular visit to the dentist every 6 months. In between regular visits to the dentist, there are simple steps that each of us can take to greatly decrease the risk of decreases the risk of developing tooth decay, gum disease, and other dental problems. These includes what we have to do: brushing thoroughly twice a day and flossing daily, eating a balanced diet and limiting snacks between meals, using dental products that contains fluoride, including toothpaste, rinsing with the fluoride mouth rinse, making sure that children under 12 drinks fluoride water or take a fluoride supplement if they live in a non-fluoridated area. Different type of oral hygiene products, how to floss, how to rinse, how to do accordingly. For oral care products, there are toothpaste, there are mouthwash, and there are teeth. So we'll discuss these things: toothpaste, mouthwash, teeth whitenings in our next class.